Hello, my name is Scott Richardson, and I'm a doctor of acupuncture and oriental medicine. As I'm talking with a lot of my athletes and with other medical providers, I will explain what it is that I do in my practice, and sometimes I get the response of, but you're an acupuncturist. So I want to explain a little bit about who I am as a provider and what it is that I do. First of all, in order to be licensed as an acupuncturist, it is a minimum of a 4-year graduate program. I personally have done additional training. I've done an additional 2 years of postgraduate work in order to get my doctorate in acupuncture. Now, that is all through schools here in the United States, schools that are regionally accredited and recognized by the Department of Education. In addition to that, I've also had the opportunity to study abroad. I studied at Chengdu University and I completed their international training program for acupuncture and herbal medicine. And I also had the opportunity to do an apprenticeship in Taiwan. Now, as far as some of the things I do, people are surprised when I talk about acupuncture, as well as doing things like dry needling, injection therapy, acuprolotherapy, or some of these other techniques. And that is something that is very much a part of this medicine and this medical system. Traditional East Asian medicine isn't something that started thousands of years ago and then stopped. It is something that continues to evolve, and especially in China. There are research studies that are being done all the time about how we can utilize this medicine and make it more effective and have better outcomes. So it's not just something that was practiced 2,000 years ago, but it's something that is continually practiced today. Now again, as far as doing some of these injections and needling techniques, I would also like to point out that that is the basis of our education. I literally have thousands of hours of training on how to needle a body effectively and for therapeutic purposes. So when it comes to doing a technique like dry needling, which in my opinion is just one form of acupuncture, or doing injections, again, I have thousands of hours of training. I have well over 1,000 hours of clinical, supervised clinical hours where I am refining and perfecting those techniques. There isn't another profession that I am aware of that spends that much time focused on how to treat the body in a natural and holistic way using needles, whether those are acupuncture needles or hypodermic needles. So again, my training is very much rooted in how to treat the body naturally and doing acupuncture, dry needling, and injection therapy. Some of the things that we have added to our practice besides just those traditional acupuncture treatments, the dry needling treatments are a very effective way to help, especially with sports medicine. Acute injuries where the muscles have tightened up, you need to recover, we can go in, get the muscle to release, let go, and get the person back out doing the activities and the sports that they love. Injection therapy, there are a number of different ways that we can utilize that. There's acupoint injection, where we can have a stronger effect than just the acupuncture itself. We can have prolotherapy, which is using sugar water, and I will do a combination of not just dextrose, but I'll add in a couple of other things that seem to expedite the healing process as well. And then acuprolo, where we combine the prolotherapy along with traditional acupuncture points to get, again, even better results in the prolotherapy itself. Always check the website for other things that we're adding, but if you have any other questions about what I do as a provider or about my training, I would encourage you to reach out to me, and I'm happy to explain more about what it is that I do. Thank you very much.